Hello, everyone. I'm Angelica Cavalcante, project manager within the French Health Agency, Agence du Numérique en Santé. And I will be moderating the discussions and also sharing some information for your understanding. We are really glad to have around this virtual table Nella Savolainen. She works for the Finnish Minister of Health and Social Affairs, and Lisa Lvova from TAKE in Estonia. I took the liberty to add some slides to this presentation. Unfortunately, they are in French, but the idea is just to share with you some general information on my Health at EU project and services. So the idea here is just to show you that we have some prerequisites to integrate this this program. The idea is that each member state needs to put in place, needs to set up a national contact point for Ehealth, which is the intermediate actor, let's say like this, between the national infrastructure and the infrastructure from other member states and some services offered by the European Commission. And I would also like to tell you that let's continue. The idea is also to say that the information is not shared by the internet, on the internet, but via the TEST network, okay? TEST is a trans-European service between administrations, so only, for example, public bodies can use it. The idea is to allow citizens in Europe to move from one country to another and being accompanied by their health data. So if they need to see a healthcare professional in another country, they can use the services from My Health at EU. And I can go to the next slide. I think the other schemas, other information could be useful for understanding the rest of the presentation. My Health at EU for now has two operational use cases. Here in France, for example, and in other member states, we are able to allow healthcare professionals to access patient summaries from European patients. Other countries can also share health data of their citizens. So, for example, for instance, people from Portugal, when traveling in Europe, they can share their own data with European healthcare professionals. And we also have another service, which is e-prescription and the e-dispensation. So the idea is that, as you know, if you have an electronic prescription in your country and you go to another one, the idea is that you can be dispensed, delivered the medication in an European pharmacy. Other use cases, other services will be integrated to My Health at EU. We can talk, for example, about the lab results, image reports, and discharge letters from hospitals, but also an extension of the patient summary with data from rare diseases. We can go to the next slide. Here, the idea is not to go deeper in the technical discussion, but just to say again that we have this national contact point intermediating the communications between the national infrastructure and the European one, with some core services offered by the Commission and the infrastructure from the other European member states. And this is all I wanted to say before inviting. So we have two schemas. One is for the e-prescription, you know, and the other one for the e-dispensation, because the European country needs to send any dispensation to the country of origin of the patient to say that some medications have been dispensed. And that was my message, just to be sure that everyone knows what is My Health at You and which are the use cases already operational today. And I'm really glad to invite our colleague Nela Savolainen from the Finnish Ministry of Health and Social Affairs to present. No, I'm really sorry again. I think it's Lisa from Estonia. So Lisa Lvova from TEIK in Estonia will share with us the main lessons learned on this e-prescription implementation.
Awesome, thank you. Thank you for the introduction. And thank you for the whole event. Seems really useful, and I'm glad that we can always share our experience. I do have to apologize for the fact that I wasn't part of the e-prescription team right from the beginning, and I joined TEIK after Estonia already went live with the initial e-prescription with Finland, but I carried on from there, and still I can speak about many aspects of the service and also how it happened in the beginning. The main lesson, I'd say, is always communication. And it was really important to understand how the overall e-prescription works in other countries. For example, in Estonia, we prescribe medications using the active ingredient, but most of the other countries, they prescribe, let's say, brand names. They prescribe, I don't know, Xanax or something like that, but we prescribe the actual active ingredient. And this already makes the whole system more difficult, because you don't have maybe the same brand name or something. And you have to understand from the beginning how the e-prescription and the dispensation works in the other country. In addition, I do believe that most of the countries, they have different pharmacy information systems, and so do we. We have integrated two pharmacy service providers into the system, and in both of the information systems, the workflow and dispensation happens a bit differently. So you have to be aware of all the differences there. And we've come across into like situations also where our prescription center requires some data fields that are not mandatory in the cross-border e-prescription exchange. So also you have to understand that is it something that you want to take into the work groups for the European Commission to resolve it, or is it something that you can resolve nationally? Then in addition, I think one of the most difficult parts in the beginning was to understand how the substitution of medications work, because we might have the same medication, but the brand name might be a bit different, let's say in Estonia and in Finland. Even when one letter is changed in the brand name, it still might be the same brand name, but you have to understand that what you are dispensing is the correct medication. And you also might have different representations of the same product, and you are not able to calculate the proper amount of the medication. For example, we've had a certain medication named Ozempic, And this is like a really good example of medications that are described differently in different countries. In Estonia, the amount of the medication is, for example, 4 doses. In Finland, it's described as 1 pen, and in Portugal, it's 3 milliliters. So you have to understand how to actually make the dispensation with the same medication, but if the amounts are described differently. So yes, this is important. And we've also had we've had the situation where also, once again, the Finnish prescriptions, they have longer validity than Estonian ones. But when it comes to cross-border e-prescription and dispensation, then the dispensation should happen according to the country B rules. So when a Finnish patient comes to Estonia, then Estonian rules should be applied. When the Finnish prescription is valid for 2 years and Estonian prescription is valid for 6 months, then you still have to make the dispensation because the prescription is valid. But you see that there's like a discrepancy between the validity dates that you have to have agreements or understanding that that these things happen, and this all requires communication. Yes, so next slide, please. In addition, this is something that I was already part of, was once the European Commission's grant agreement ended, we had to fill out a lot of documentation. And since, once again, I wasn't part of the e-prescription from the beginning, I wasn't aware of the fact that in the grant agreement you have certain sections and points that have to be carried out and also documented very thoroughly. And you have to present the documentation afterwards to the Commission. So it was really difficult to actually fill out some of the points afterwards. So whenever signing a grant agreement with the Commission or anyone, then it's really important to make sure that all the points are understood by all of the parties, and what are the activities that have to be done afterwards. Next slide, please. Then, as always, everything takes more time than usually. One of the, I'd say, biggest blockers in our way was, for example, production testing. In order to get the service up and running and live, then you have to follow certain European Commission procedures, and you have to pass pre-production testing and also production testing. In our case, we don't have a test patient in production environment. So how we did all the production tests was like that I don't know, even I called my family doctor to issue me some prescriptions that the other country can then dispense. So we could have the actual data flow tested in production before actually going live. And it was really difficult to even foresee this problem or issue that you have to have a test patient in production. Also, when it comes to the beginning of the service, then different legislative changes, they also take a lot of time. For example, in Estonia, when you want to change the law, the minimum time is 6 months that this can actually happen. But usually law changes are bigger and it takes even longer. And in addition, we had to create DPIA for the service. and you have to update it constantly. So this is also one of the really specific tasks that have to be carried out, and it simply took a lot longer than expected. And the last part, this is something only from my perspective, that I know most of the IT houses and all the developers, they want to do everything agile, and this is something how projects usually work faster and are better. But in this kind of a huge project, I think it's really difficult to include like agileness into the whole project. For example, when it comes to the e-prescription or even a patient summary, then we have one huge upgrade once a year. And this is far from agile. We don't have like this continuous testing and deployment integrated, and the whole project is more like a waterfall project, that you analyze something and then you start the development and so on. So it's it would be nice if we could like integrate more agileness into the whole project. But I do understand also that the project is huge. It includes a lot of countries, and all the countries, they have different systems, different developers, and so on. So it's something to maybe work on in the future. Thank you.
Thank you very much, Lisa, for this relevant information, this return on your own experience. Here in France, we don't have for now this e-prescription service operational. So we are very much looking forward to learn from you and from other colleagues. And now I'm really happy and delighted to welcome Nella Savolainen from the Finnish Ministry of Health and Social Affairs, who will share with us the Finnish experience regarding My Health at You and the implementation of the prescription.
Thank you so much, and I assume you're changing the slides from there. Thank you. So thank you for having us and inviting us from Finland as well. I am also not really, well, I'm not an expert on this subject, but because of the vacation period has started, and actually the most responsible people, people working at the national contact point in Finland have already started their vacation, but as the responsible persons in the ministry side, we are here with my colleague Riikka, who is there as well online, so we can then, if you have questions later on, we can try to then answer them. But well, there's this in this slide you can see the structure of the presentation, and I can skip quite quickly the first spots, but I will talk to you about a little bit about the whole infrastructure of the Finnish Ehealth service and the current situation that we have, and then go to the lessons learned that were the major subject on this workshop. Thank you. You can go on to the next slide. So the Finnish Ehealth service infrastructure is based on the Central National Repository, which is called Kanta Services, and it's an entity of digital services. And there are all the data of patient social care and prescriptions gathered in this repository. And healthcare professionals can access the needed patient records nationwide and store patient records and maintain prescriptions. And citizens also can browse their own medical records and prescriptions in Kanta. There are My Kanta pages for that. And this is just, you can skip this slide and go on to the next slide. And the current situation on the digitalization development on this side on electronic prescriptions is gathered on this slide. the electronic prescriptions and patient records are established well in Finland. There's a very high general acceptance among citizens on these. 100% of prescriptions are electronic. It's been mandatory since 2017. And then also the patient records, over 95% of them are stored in Kanta, and it's mandatory. So maybe you can then just skip on the next slide, please. There's some figures in this slide from Kanta services of the cross-border prescriptions, the amounts. And you can go to the next slide. So current situation in cross-border prescriptions is that Finland and Estonia, of course, were the first countries to introduce this service, European cross-border prescription in 2019. And on average, approximately 20 prescriptions are dispensed in Estonia and Finland per day. And as I mentioned earlier, the technical maintenance of the service, the national contact point, is provided by Kela as a part of Kanta services, and Kela is the national social security institution in Finland. And we also had to upgrade the legislation a little bit. Now you can go to the next slide, please. So now I continue on with the lessons learned, and these some of them are quite detailed, but I'll try to go through them. So I can just agree on the things that Elisa just told from the Estonian side about the actually the communication and the different validity times and everything taking longer than planned and those kind of things. And but still, I should say that there is actually quite a lot of workforce moving in between Finland and Estonia, and people living partly in both countries, and of course these people surely benefit from these kind of services, even though we need a little bit more study maybe on these benefits and on the customer experience, so to say. But these points that are shown in these next slides and this slide are given by an expert from the national contact point, Kimmo Rissanen, who is I guess in charge of this service in Finland, and I asked him for help, and he provided me with these experiences. So that we have this existing centralized Kanta service has made the implementation of cross-border services, of course, easier, but there still are challenges, and it makes it possible to implement solutions only once, and but translations is maybe a challenge, because currently not all data content is coded, so it challenges the translations. And then the optimal solution requires changes in all the electronic health records in use, and current solution might compromise the patient's safety at times. So, for example, what medical products are interchangeable, and maybe what Lisa said before about the validity periods and these kinds of things. And it's also difficult to ensure the interoperability between national codes and the common EU code lists. And these are quite detailed, the points, but at national level, the latest version of ATC code system is adopted, but for example, this EHDSI 2 years old version is being used. So it requires mapping of the codes to a higher level of hierarchy within our code systems, and it contributes to a loss of information. It has been experienced this way, and Then there's maybe more semantic level issue problems are expected if we join the patient summary implementation. We are planning to join it next year. So this translating and maintaining code lists between EU and local national levels have been challenging. Yes, the next slide, please. And I think Lisa also talked about the testing, and the testing periods are quite challenging and require resources and time. And of course, at this time, the finding testing partners is difficult because there's not so many countries in production. And their dates also determined for testing, but then the schedule is challenging for everyone. Not everyone stays on schedule all the time, and a degree of preparedness of the implementations to be tested, and the competence of the testers is not always at the expected level. The reference specifications are not specific enough, and also at a national level, the motivation is a challenge sometimes, which I'll maybe talk a little bit more about on the next slide. If you could change the slide, please. Thank you. Because of the use of the service is quite limited, there's this discussions and critical feedback received on the cross-border services. Maybe they're not well known or enough known by pharmacists or citizens, and there's discussions on the business case, so to say. Is it wasting tax money, or is it like marginal services, or is it important enough? And the time issue, that progress is low, and even minor changes take time and resources, and then that, well, maybe despite the slowness, that standardized development cycle enables controlled progress and the development of services. So the people in Kela feel that the governance model is rigid, but it's still effective, and they've been really happy with the cooperation between representatives of other member states, and it has worked well. And there's always assistance available on request from the Ehealth network, for example. So I think these were the lessons learned that I received from the national contact point in Finland. And I have one more slide here, which is just a glance on the Finnish EHDSI organization. So you can see that there are many actors on this, and the ministry is there on the up right. So there's a strategic level guidance and legislation and financing and link to the Ehealth network as well. But thank you for your time, and this was all I had to say today. Thank you.
Thank you very much, Nella. Thank you for being able to join us at short notice and for this very interesting presentation. So we are also lucky to have here with us Marc Loutrel. He is the Director Expertise, Innovation and International Affairs at the French Health Agency, and he's able to say a few words on the e-prescription for France. Let's see like this.
Thanks a lot for your presentation. On France, we are not so advanced in terms of implementation of the e-prescription, but what I can say is that it's very interesting. We have started our e-prescription a year ago in France with use case on a prescription for medicine on a medical device. The implementation that we have done in 3 different areas in France. France is divided in 90 areas for to make it short, and it's quite a success. And I'm quite impressed by the percentage that you, in terms of e-prescription that you get. Unfortunately, we are going to make things happening quite the same that you have done. My question will be, did you accept what you have done in terms of e-prescription at the European level? Did you implement some other use cases, such as e-prescription for biology? Because we are really looking forward for that, especially in the transformation program that we are managing in France. It's called Sigur Numérique. We are entering the second phase of this program. So have you done so in your respective country? Quite interesting to see what are the lessons learned from what you have done. You can.
Hi, maybe it's a little bit hard to hear the questions, so maybe if you could just repeat the question again.
The question was about e-prescriptions for other areas than the medication, for example, for biology. So do you have things like this at a national level in Finland and Estonia?
Actually, I don't know the answer for that, but I don't know if my colleague knows that answer, who is online also, Riikka. Maybe if Lisa can answer first.
Thank you. And
Riikka is there. Thank you.
Yeah, thank you. I think within the Finnish borders, there are some national level discussions on e-prescription development for new areas, but I don't think there's yet any discussion between Finland and Estonia.
Well, in a cross-border situation now, from Estonian side, we use e-prescription for medical devices also, but not, as far as I know, not for anything else. And once again, as far as I know, we don't have any additional plans there right now for I don't know, any other use cases.
Yes, thank you. Thank you for your answer. Just to try to make a comparison, if it's possible, I would like to also maybe have another question. Let's say maybe to link that with the European initiative on the EU digital ID wallet. For e-prescription in France, one of the main difficulties was we have two centralized databases, one for the electronic health record and the other one for prescription. So in fact, the doctor who does the prescription generate a electronic prescription on a paper, but as well on an electronic way in order for the patient to go to the pharmacy. On the pharmacy, just have to flash QR code. And I'm coming to my question, because QR codes are very well used now. With the COVID, we are all using a COVID certificate. On the EU digital COVID certificate was quite a successful, let's say, we can be proud, so worldwide. Do you plan to use the e-prescription for medicine or medical device this way on the infrastructure that you have built for the digital COVID certificate, because it's quite easy of use for the patient? Would be my first comment or question. And second, you or will you participate to the European initiative on by DG Santé to make a link with EU digital identity wallet, which is quite interesting because they have two use cases on Ehealth, and one is on e-prescription.
Yeah, sorry.
Well, I was just going to say that on the second question, I can say that we are not currently planning to participate on the health health use cases in e-prescriptions, but we are continuing to follow the developments and interested in it. But currently we are having this major social and healthcare reform in Finland. It's really binding resources on this digitalization development as well. But I don't know about the first part. Maybe my colleague can then later on answer on this, but maybe Lisa can first continue on answering. Thank you.
Well, from the wallet question also, I just wrote to the ministry, to my main contact, to ask about that, because I know that Estonia has been part of some work groups and some discussions, but I don't know the answer for that, whether we're participating there. And regarding the medical devices, I didn't quite get the question there. Do you mean that how are we even using the prescriptions overall for medical devices, or should we like use it with a QR code, or could you please repeat the question there?
The EU digital identity, or the EU, digital COVID certificate, you have been an infrastructure, a national infrastructure, which is compatible or interoperable with the other national initiative in order to travel inside Europe. This infrastructure is at the European level is quite interesting, but at the national level, with all the QR code on the verification of this QR code, where
Riikka also replied in the chat that in Finland there is some discussions and plans for prescribing, prescribing medical devices or apps, but no actual development plans at the moment. If that was the correct answer to that question, that I didn't really get that much to you, but maybe you can write it.
No integration in the future.
Sorry?
I don't think they're planning the integration.
So thank you for that. I was wondering if some attendants would have some questions, maybe people in the chat or here around the table.
That's a question from Evelyn.
Evelyn, are there prescriptions and dispensing? Did you read it? Okay, we have a question from Evelyn Donoho. I don't know if I'm pronouncing it right. Sorry. So the question is, are the prescriptions and dispensing interoperable and exchangeable between hospitals and the community pharmacists? I believe this question is general. So for Finland and Estonia, who would like to go first?
I can go first. Well, yes. Well, in the Estonian case, it all depends how the architecture of the system has been built up. In Estonia, we have health information system where all the healthcare providers can get the patient's data. In addition, we have the prescription center, and all the dispensation information eventually goes to the prescription center when you dispense the medication. And the healthcare providers in the hospitals, they can query the patient's data, where they can also see the dispensed medications, they can see the prescriptions and basically everything else. And in the pharmacists, they don't have that many rights when it comes to health information system. They can see the patient's prescriptions, but they can't see the already dispensed medications. So yeah, and I think that Finland has it almost the same as we do.
The pharmacists have limited access to the data, but we are currently doing legislation changes to advance the access to data for required professionals and citizens both.
Okay, do we have a question here?
I've just one question is, do e-prescriptions include diagnosis? And if yes, how are they coded?
Rephrase maybe, because maybe there's some-
In Estonia, we do use the diagnosis and the prescription with the ICD-10, I believe. But the diagnoses aren't always 100% correct, because sometimes the medical professionals, they want to give you a bigger discount on the medications, and then they basically they write a different diagnosis. So this is not a correct way to do things, but this sometimes happens. So the diagnosis isn't always correct.
We have another question here in the room.
Do you use the SNOMED, the open source platform?
Yes, in Finland, yeah.
Yeah, I think we have this for medical devices. I'm not 100% sure right now, but yeah, we also use it.
Thank you.
So I would like to thank you all for being here and sharing all this valuable information with us and with the ecosystem. So thank you again. So have a great day.
Thank you so much.
Thank you.
Thank you very much.